Yeah, well, we do seem to be turning the corner on COVID-19. The state is bracing for another possible surge soon, as well as worried about people who are not seeking treatment for other problems. The governor is encouraged by ongoing declines in COVID-19 cases, especially as kids go back to school, with some beginning in-person classes.
I think we do it in a safe way for our students and for our teachers, minimize the risk to our students and to our teachers with what we've put in place. I also like the trends that we see that are taking place. The case numbers are falling and our transmission rates are going down. So I think we're in a good place. But I would emphasize it's no time for us to be complacent.
Pressed on back-to-school plans, the governor acknowledged there is a risk. The chance schools could close down if there's a surge in cases.
All the plans, though, have, in fact, a plan B to it.
While COVID cases have dropped, so has the number of people seeking tests.
Our best information seems to be that there is less prevalence of the disease in the state.
Utah's Department of Health has expanded some criteria for who can get a test in certain communities to see if the virus really is declining, but won't begin testing just anybody.
We're also looking forward to the future and to see what's coming next around the corner. We have back to school that we're talking about and whether or not that's going to impact the number of tests coming in. And then we have the flu season coming too.
Meanwhile, Utah's healthcare companies have noticed a disturbing trend. People have been staying away from hospitals and clinics, afraid of seeking medical care because they're worried about getting COVID-19.
It's really important that you don't delay care.
Intermountain Healthcare's chief physician says that creates more problems.
There's been a 40% reduction in the number of patients presenting to have stroke symptoms assessed and treated. There's been a 35% reduction in the number of patients presenting with symptoms of heart attack. And in these conditions, every minute counts. So please, our hospitals are safe. We're ready to care for you. Don't delay care for these life-threatening conditions.
The governor says if you even have the mildest of symptoms for COVID-19, you should seek out a test, and he continued to urge Utahns to practice essential social distancing, staying 6 feet apart, good hand hygiene, and of course, wearing face masks. Live on the Hill, Ben Winslow, Fox 13 News, Utah.